Hi, this is me, late to the train, waiting 2 hours for the next one. It might sound ridiculous, but this is the moment during my clinical education internship where I started to think about accessibility in healthcare. To understand why this matters to me, you need to know a little bit about where I come from. My name is Savannah, but legally, or when my mom's mad at me, I'm Savannah Mary Guadalupe Gallegos. I'm a 15th generation Nuevo Mexicano in Genisaro. I was born in Las Vegas, New Mexico, but grew up on my family's land grant in San Miguel del Vado. Most people have no idea where that is, so I tell them I'm from near Pecos. If they know Pecos, I say Villanueva, and if they know Villanueva, I tell them Vaito de las Piedras. But no one ever knows that, so let's just say I'm from Villanueva. Growing up rural meant gardening, milking cows, stacking firewood, and playing along the Pecos River. Like a lot of kids in my area, I didn't have a regular pediatrician. Care came from rotating nurse practitioners and PAs at El Centro Family Health, either at their San Miguel location or their school-based clinic in West Las Vegas. When I was 11, I got viral pneumonia. For 2 weeks, I was misdiagnosed with RSV and the flu. I ended up hospitalized an hour away from home, and by the time a nurse at my local clinic caught the mistake, I had lung scarring and lifelong asthma. This killed my dream of becoming the first New Mexican to go to space, though this guy had already beat me to it by about 30 years. It also sparked something new, a question about why care fails people like me from communities like mine. This question followed me into my internship at Aspen Medical Center in Santa Fe, a locally owned primary care and urgent care clinic. Here, I shadowed under Dr. Rapp, Dr. Chavez, and a handful of wonderful nurses, PAs, and medical assistants. It was here that I started noticing patterns, how many people had chronic conditions like hypertension and diabetes, conditions we associate with lifestyle but rarely think about in terms of access. And it made me think, what does it really mean to have access? So you might be thinking, what does all of this have to do with me being late to the train? Online, Santa Fe looks like an accessible city. It has a high walkability score and plenty of healthy food options at first glance, but I decided to see for myself. I chose an arbitrary spot along Cerrillos and Airport, an area with higher crime, poverty, and fewer public services than other parts of the city. I timed how long it took to walk to the nearest grocery store, recreational green space, and the clinic I was shadowing at. As I went, I observed the material conditions in common walking paths and what that meant for pedestrians, especially for people with unique needs like walking aids or young children. A lot of factors shape whether something is truly accessible, things like cost, time, and distance. But the way a space is actually built can also make just as much of a difference. Factors like shade during extreme heat, the condition of sidewalks, the presence of crosswalks, or how safe a place feels all impact whether people can or even want to get to where they need to go. In some parts of Santa Fe, the real barrier isn't distance. It's the day-to-day obstacles that make walking hard or dangerous. So while Santa Fe is walkable on paper, on the ground, it's a different story. For my first stop, I visited the clinic. It's only about a 20-minute walk with a decent bus route nearby, but the sidewalks were crumbling, the crosswalks felt risky, and traffic in the area is known for speeding. In the summer, temperatures regularly hit the 90s, and without shade, which this area lacks, walking can be uncomfortable at best and dangerous at worst. Next, I walked to the nearest park, Los Acequias. It was about 20 minutes away. The playground was nice but totally empty. With no shade, the equipment was too hot to touch, and residents told me that even in cooler weather, people avoid the park because it feels unsafe, especially later in the day when poor lighting and crime are concerns. I heard similar stories when I walked to the closest grocery store. It was a 15-minute walk, but the intersection was confusing, with faded crosswalks and heavy traffic. I hardly saw anyone on foot. Heat, safety, and convenience push people toward nearby fast food instead. This part of Santa Fe is considered a food swamp, meaning healthy options are limited while fast processed food is everywhere. The sidewalks on the south side were often narrow, overgrown, under construction, or just ended without warning. For someone using a stroller, cane, or wheelchair, these small obstacles can completely change how or whether they can travel. Accessibility becomes even harder the more rural you are. I thought about how patients from my home community get to Santa Fe. First, you need a car, just to reach the park and ride. If your car is running and you can catch one of the 2 early morning shuttles, you might make it to town. From there, you can take a city bus or try to catch the train. But if the train leaves early, which I've had happen, or if you miss it, you're stuck waiting an hour or more for the next one. Driving yourself takes over an hour, but for many people, it's less frustrating than relying on public transit that isn't always reliable. These barriers may not seem life-threatening, but for people with mobility challenges, kids, or those without reliable transportation, they add up. Sometimes these small obstacles can be deadly. I've seen firsthand how distance can cost lives. On March 22nd, 2016, my aunt Desiree Castillo drove from our village to Santa Fe for a routine prenatal appointment. She was 20 weeks pregnant, and she, like others, had to seek care farther from home because the OB program in Las Vegas had been gutted. At some point on her hour and 15-minute drive back, heavy winds and a faulty seatbelt caused her car to flip. My aunt Desi died on the scene, along with her unborn son, Ezra Augustine. To this day, my family cannot drive past mile marker 110 near Pecos without thinking about her and what might have been. And the unfortunate truth is that her story isn't unique. Countless people from rural communities have lost their lives traveling for care that should have been closer. And every time this happens, you can't help but wonder, what if access had been different? It's not all bleak. New Mexico has programs like Double Up EBT to make farmers markets and co-ops more affordable. Albuquerque offers free public transit. And while more is needed, Santa Fe has made strides, like significant savings on buses for seniors, students, and people who purchase monthly passes for the rail runner. Like online outlets will tell you, there are resources available in Santa Fe. It's often getting to them that's the hard part. While this project focused on ease of access, I've met patients facing other invisible barriers, like childcare, immigration status, or the inability to take time off of work without risking everything. There's no one solution, but the first step is naming the problem. Advocating for safer streets, better public transit, and initiatives that meet people where they are is how change begins. Something as simple as more regular, reliable times for the train could make or break whether someone can or even tries to get care. It is easy enough to tell a person to eat healthier, exercise more, or to attend all of their preventative care appointments, but the feasibility of these changes can be a compromise between an individual and the circumstances around them. Since starting this project, I've come to a profound realization. Sometimes the choices we make for our health aren't the best available, they're just the most accessible.